Good morning. I want to thank everyone for joining us today, our YVI community, for those that are present with us and for those that will be listening to the recording. I'm really excited about our special guest today. She's coming to us out of Cary, North Carolina, which is between Raleigh and Durham, North Carolina. Dr. Nancy Love is board certified in veterinary radiology by the American College of Veterinary Radiology. She attended the University of Illinois and received a Bachelor of Science in Animal Science. She then graduated magna cum laude from Tuskegee University with a Doctor of Veterinary Medicine degree. She completed a small animal internship at Michigan State University and was invited to remain for a radiology residency. She's working as a tenured associate professor at North Carolina State University. And when she left to join VCA and TET. I'm probably not saying that right. I'm just going to skip down a little bit because there's so much to say about her, but I also want to say who has helped her this morning get on our video. She's married to Dr. Robert C. Sills, DMV, PhD, Chief of Pathology at the National Institute of Environmental Health Sciences. Dr. Love works as a radiologist to support her passion of competing her purebred Spanish horse, which I can't wait to hear more about that. So I'm going to stop right here and just thank you, Dr. Love, for coming on. And thank you everyone else that's already on joining us.
All right, well, good morning, everybody. And thank you for coming. This morning, we're going to talk a little bit about veterinary radiology. And we're going to actually have a opportunity for everybody to actually kind of practice being a radiologist today.
All right.
Good.
Okay, hold on. So what is a veterinary radiologist? I thought we'd start with that. So a veterinary radiologist is a veterinarian. So I'm a veterinarian first, but not only am I a veterinarian, but I'm a specialist who interprets animal imaging studies. So I don't see patients anymore. I don't give shots. I don't do surgery. I don't do general practice medicine. I just look at images of animals, and then I tell other veterinarians what is going on in those films. So not only is there a specialty for radiology or for veterinarians who just look at images, there's also subspecialties within my specialty. So there are veterinary radiologists who do radiation oncology, and that's using radiology, or that's using radiation to treat cancer in patients. There are radiologists who only look at horse images. And then there are radiologists who only look at what's called cross-sectional imaging. And that's maybe what you've heard as a CAT scan or an MRI. And so that's mostly brains. And so that anatomy is very, very complex. And so there are radiologists who just spend their time working on that. So there are 22 veterinary specialties in veterinary medicine. And veterinary radiology is a specialty that was established in 1961. But that's just one of 22, right? So there's surgery, there's cardiology, there's dermatology, there's what else? Ophthalmology. There's many, many, many specialties, 22. And most of the specialties that are in veterinary medicine are the same specialties that you see in human medicine, but we just treat animals. So right now there are about 73,000 veterinarians in the United States, but there are only 686 veterinary radiologists that are certified in the United States. So there are very few of us who do what we do. We're very highly in demand. There's more work than there are veterinary radiologists to do the work. And so right now, artificial intelligence is being developed by lots of large companies to try to handle some of the workload because there's so few veterinary radiologists in the US. There are also veterinary radiologists that are certified in Europe. Some of the European radiologists are certified in the US and in Europe. And if you add the European radiologists and the US radiologists, there are only 800 veterinary radiologists in the entire world. So it's a very rarefied, it's a very small group of us who do what we do. All right, it doesn't like that. So I'm going to teach you a little bit of the lingo, because you hear people toss around board certified and boarded and that sort of stuff. But if someone is board certified, it means that they've taken a test to be able to be a specialist in their area of interest. So each of the 22 specialties has an organization that certifies the radiologist or the veterinarians in their group. And those certifying organizations are called colleges. So radiology is the American College of Veterinary Radiology. So it's the ACVR. And so the ACVR sets the standards to become veterinary radiologists. So it tells veterinarians what studying they have to do, what coursework they have to do, how long they have to do it, and then they have to take a test and pass that test to be able to call themselves a radiologist. So once you become a specialist, you're called a diplomat. I know it says diplomates, but it's pronounced diplomat. And then you have to be certified by your college to call yourself a board certified veterinary radiologist. So just because you like radiology, you can't go out there and tell the public, I'm a radiologist. That's not legal. You have to be certified by the college before you can do that. So what do radiologists do? Well, radiologists are part of a team that help diagnose and treat patients. We don't generally see the patients ourselves. Like you don't come to us if your dog has a broken leg or it's coughing or it needs its shots. We're part of that team. So usually it's a general practitioner or a specialist in another area that has a patient that needs an image to help them make the diagnosis or their treatment. Sometimes we do the imaging test ourselves, but generally we have technicians to do that work for us, and then we interpret the information that the technicians generate for us. But sometimes we do the studies ourselves. And so this is a veterinary radiologist doing an ultrasound examination on a dog. And so they've got the probe on the dog's, I can't see the image entirely, but I think it's the abdomen. And then the image comes up on the screen, and then they have a big monitor so that the other people in the room can see what the radiologist is seeing while they're doing the study. So we sometimes do the imaging test. Then we look at the images and we decide what's normal or abnormal on those images. And then we give a list to the doctor of the possible causes of what's abnormal. And then we offer a recommendation of what to do next. So sometimes that's more imaging. Sometimes it's a different imaging test. Sometimes we give treatment recommendations. So it's important that you pay attention to that, because it's going to come up later. So again, we look at the images, we decide what's normal or what's abnormal. We give a list of what possible causes of what's abnormal, and then we can offer some recommendations. All right.
Dr. Love, does it interfere too much if I ask a question as we go? Or
absolutely not.
It's just been bothering me. You said that it didn't become a specialty in veterinary medicine as far as radiology until 1961, but x-rays were out way before then. Why did it not become a specialty until 1961?
Because in veterinary medicine, we did not have specialty organizations until the early 60s. So there were people doing radiology. There were radiographs were being made in practices, but everybody did everything, right? So the veterinarian did the surgery, the veterinarian read the x-rays, the veterinarian gave the shots. the veterinarian did the health examination. But then there was a group that said, hey, we're missing stuff here. There's ways we can make this better for our patients. And so a group of veterinarians who were just general practitioners pulled themselves away, focused on radiology, and worked together to come up with some criteria to make radiology a stronger modality in veterinary medicine. So that's how it happened.
So by doing that, people that focus, that become more fine-tuned on that, catch more things versus the doctor that's just kind of looking at it, missing things because that's not what they specialize in.
Right. And they saw and they saw that in human medicine that radiology was an integral part of the treatment of patients. And they knew that there was more they could do in veterinary medicine, but somebody had to make it a focus and then train other people to do it. So that's how it happened.
Okay.
Good question. Anybody can ask a question at any time.
I just want to, before you go on, Nancy, I just want to say welcome to Bailey Brown. Bailey is one of our star students.
Hi, Bailey.
And yeah, she's just outside of Houston. And so go ahead now.
So what makes a good radiologist? So to be a good radiologist, you have to be really good at anatomy, and you have to be good at anatomy in all types of animals. You have to have a good eye for detail. You have to be good at pattern recognition, because what happens is you look at things over and over again and something looks different. And so you have to get really good at, wait, that's not right. And so that's pattern recognition. And then you have to be able to think in different planes. You have to be able to look at an animal from the side, from the top, from the front, from the back. And you have to be able to think about that anatomy from all the different directions. And then you have to be able to problem solve. So I think the liver's big. Why is the liver big? Is it big because it's a young animal? Is it big because the animal ate something and it's poisonous? You have to just be able to problem solve and then figure out why what you see is happening. So how do you become a veterinary radiologist? Well, it takes a really long time. It takes 4 years of veterinary school. Then you have to do an internship, or you can do clinical practice. You don't have to do an internship. I did an internship for 1 year. So you have to do at least 1 year of some sort of practice. It can be in large animal, it can be in small animal. Then you do a radiology residency, which is either 3 or 4 years. They're sort of becoming more 4-year programs. And it's very, very competitive. It's very hard to get into a radiology residency program. Only the top students and interns are accepted into the limited programs. Then after you do your residency, you take a test, and the test is 4 days. So you take a 2-day examination that's written, and then you pass that. And then you take a 2-day examination that's a practical examination, where they ask you to look at films and interpret them. And then after you pass that, you can call yourself a board certified veterinary radiologist, or you're a diplomat of the American College of Veterinary Radiology. And then once you become a radiologist, you have to continue your training. So every 3 years, I have to go to a radiology meeting to make sure that I'm up to date on what's happening in veterinary radiology. I have to do continuing education every year to keep my license as a veterinarian, but every 3rd year, I have to do something that is certified by the ACVR to keep my status as a board certified radiologist. So once you pass the test, it's not done.
Now, Dr. Love,
yes,
I know that you said it takes a long time, but
yes.
For our students, while you're taking a long time, you're still doing all those things that you love to do on why you
absolutely
started this,
right? So first of all, veterinary school was a blast. I had so much fun in veterinary school. I really wanted to be there. It was exciting to go to school every day. I learned something that I was interested in every single solitary day. So that 4
Right.
years went really fast because it was so much fun. I met lots of friends. We had fun. We didn't just go to school. We had lots of parties. We ate lots of good food. So veterinary school it was hard, but it was also really, really fun. And it was a really good time. My internship was more challenging. I had to work very, very long hours. I was often in the hospital 12 or more hours a day, not every day, but it wasn't uncommon to be in the hospital for a long time. But I didn't mind because, again, I was really learning stuff and I was getting to do stuff that I had never done before. And I trained for this and it was just really fun. So it was long, but it was a good hard, if that makes sense to everybody. The radiology residency, by the time I did my internship and my residency, I was married. So my husband was also a veterinarian. And so we both knew how much time it took to do our training, but we did find time to go on vacation and we went out to dinner and we rode horses. And so you do get to live your life when you're becoming a veterinary radiologist, but it is a big time commitment and it does take a long time, but life does not stop just because you're doing it. But it is something
You and Monique must have gone to school together or something, because I've never seen her just smiling as someone is talking. You guys must have had some good time together.
It's definitely true. It's definitely true. And my classmate Felix is on the call, and he was just sharing some memories with me about how we lived our lives while we were working ourselves as veterinary students. So yes, yes, you can definitely have fun while you're doing this.
Well,
and it's something that you want to do. You've worked very hard to get there. So yes, it's hard. Yes, it takes a long time, but it's something you enjoy going to school for every day because it's something you really, really want to do.
Right, right. And Dr. Love, can I chime in there for Bailey and the other students who might be listening to this in the future? I think one of the things and Dr. Love described it perfectly, when you get back into veterinary school, you've been in college with a lot of people and you're changing classes and everything's different all the time. When you get to veterinary school, you're going to be with your class for 4 years. And in the case of Monique and myself, it was 125 people. And so Monique was one, we were a little gang of 5 that hung out most of the time. And it comes back to being fun. School becomes fun again. I think it's a real good opportunity. So thanks, Nancy, for making that, bringing back those memories. Because like I said, Sharita saw Monique start to grin. I was grinning, thinking back to fun we had. Well, we were working really hard and learning something that we worked our whole school career to do. But it had the side benefit that you will make some great friends.
Yes,
sure.
Yeah, and I had a class of 60, so that was even smaller. So we got to be very close, and we really looked out for each other, and we helped each other. And after 4 years with 60 people, it's a family. And so it was a good time. And your internship is smaller. There were only 6 of us who were interns together. And my radiology residency, there were only 2 of us. So it's people that you spend a lot of time with, but you get close to because there's just a few of you.
I think Bailey had a question.
Go ahead.
So for the test that you have to take to get your radiologist degree, so the written part, is it like 2 days where you get to finish it, or is it 2 different tests?
No, so you take 6 tests over 2 days. So you take 3 tests the first day, and then you take 3 tests the second day. So each test is so you take a test on anatomy, you take a test on physiology. Radiology is a lot of physics, so you take a physics test. So it's those kind of tests. You take a test they're 90 minutes, and you take the 6 tests over 2 days. So no, you don't get 2 days to take the test. You take 6 tests in 2 days.
And you
It's
have
very,
nine-
it's very challenging.
and you only have 90 minutes.
You have 90 minutes, but you know, it's geared towards, it should take you 90 minutes. It's only, I don't know, you know, like 50 questions or something like that. So it's not like you have enough time to answer. If you know your material, you have enough time to answer the questions. And you know your material because you get usually a couple of months to study for the test.
Okay.
Okay. So how did I become a radiologist? Well, I had super strong mentorship. I was taught by the first 2 Black veterinary radiologists in the College of Veterinary Radiology. I was good at radiology in the classroom, and they recognized that, and they encouraged me, and they worked extra with me, and they gave me extra things to do. And they really strongly encouraged me to become a radiologist, and I can't thank them enough for that. From my first year on veterinary school, they just said, hey, you would be good as a radiologist. And I was like, okay. I believed them. And then now I am. I worked really hard in veterinary school. I graduated magna cum laude. I was 4th in my class. I did that because I wanted to have as many options when I graduated from veterinary school as I could have. And I knew that if I had really, really good grades, I could pick whatever I wanted to do when I was done. If I wanted to be a practitioner, I could be a practitioner. If I wanted to do an internship, I could do an internship. If I wanted to go into the military, I could. Every option was available to me because I had really good grades. But as I said in the intro, I did a 1-year internship, small animal internship at Michigan State. And then I did a really good job. So they invited me to stay to do a radiology residency. And then I took the certification examination and I became board certified in 1991. So this is Ellis Hall. He was the first Black veterinary radiologist. He was my first radiology teacher. He was incredibly kind to me, and he pushed me really hard, and he really made me love radiology and make me feel like I could do it. And so I really thank him for that. He just recently passed away. And I was really sorry to hear that. Ruby Perry is now the dean of Tuskegee University. She was the first Black woman to become a veterinary radiologist, and she was the second Black radiologist in the college. She and Ellis taught me, and I became the second Black woman to become board certified in veterinary radiologist, and I'm the 4th Black radiologist in the college. Mike Bailey was the 3rd, and Ellis and Ruby taught Mike. Ellis, Ruby, and Mike taught me. And so as I said, it's a family. I owe my career to them, and they are wonderful people. If you ever have a chance to meet Ruby Perry, I take advantage of it. She's a pretty cool lady.
Maybe we can highlight her one day.
I think she would absolutely love it. She's a really interesting person. She's had a really interesting career, loves teaching students. And one of the reasons that it was just so great, she actually taught me at Tuskegee and at Michigan State. So I had her for both my student career and also my residency program. And it was pretty awesome.
Excellent.
Right.
Excellent.
So what can veterinary radiologists do? So you become a radiologist and you're like, okay, now what am I going to do? And so you can work in academia. And so in academia, which means you teach at a vet school mostly. So you teach veterinary students. You can do, all veterinary schools have a hospital. So you work in the hospital, veterinary hospital, and then you do research. So that's one thing you can do as a radiologist. And a lot of radiologists do that when they're done with their training. You can work in a private practice, and some of the really large hospitals have a radiologist who is on site. You can go into practice for yourself, and do a mobile service, and most mobile services are just ultrasound because that's the only equipment you can kind of carry around with you safely. Or you can do teleradiology where you work from home. Or you can, or I should say, we can work from anywhere. It's not necessarily home. And then you can work for the military. So what I did was I did academia when I got out of veterinary school, or sorry, my radiology residency, and I worked at NC State University from 1991 to 2003. And I did all those things I said. I taught students in the hospital. I taught students in the classroom. I was a radiologist in the hospital, and I did research. While I was at NC State, I started working with one of my colleagues there, and we decided we wanted to build a teleradiology service. And we wanted to do remote radiology and do telemedicine. And so I worked with him, and we developed a company called Dark Horse Medical Ventures. And Dark Horse was a service where the hospitals would send us the films, and they would come up on the computer screen, and then I would look at them, and then I would write a report, and then I would send the report back to the hospital. And so I did that part-time while I was still at the university, because we were just getting started and I couldn't afford to not have a full-time salary. So I just did that part-time. And so then what happened was Dark Horse was bought by Antech, and then it became Antech Imaging Services, which is who I work for now. And Antech Imaging Services was doing so well that, well, not just Antech Imaging Services, but Antech was bought by Mars, the people who make all the candy. So M&Ms and all that kind of stuff. That family is insanely wealthy. And they have been buying veterinary practices, and they recently bought us. And so we get like M&Ms for Christmas. It's kind of nice. So Monique wanted me to talk a little bit about what I do specifically. And so what I do right now is, I'm right now in my dining room, but I have an office upstairs in my house, and it's dedicated to my job. And so I have a big computer. It's like 42 inches. So it's like a TV screen size monitor. And I'm attached to the internet, and I log into my company's website. And then what happens is a screen full of cases pops up. I click on the link, the image comes up on my screen. I look at the image. I have a device that allows me to talk into it, and then it writes down. So it's a dictation device. So it types everything I say. So, because that's quick. And then I look over that and make sure there's no mistakes. And then I send it back to the hospital. And then the hospital has my report. So I do that during the day. And so it allows me some flexibility, because then I can do other things, because I like to do other things besides being a radiologist. I have a couple of horses. And so I'm actually going to go ride my horses when I finish this talk. So it lets me kind of work and do my life. So I really like it. It's not for everyone. I don't see patients anymore. There's obviously no animals coming to my house. And so for veterinarians and radiologists that like to touch animals, this isn't the right kind of job. But I like the thinking image part. I don't have to see the animal to be fulfilled with what I do. So it works really, really, really good for me.
So Dr. Nancy, just like how a lot of our young people, they do talk to text. And sometimes when you talk to text, it'll say some words that you didn't mean.
Right.
So you feel it's important for our young people to know how to spell, to make sure they pay attention to their writing skills, because you're still utilizing that.
So absolutely. So when you go to veterinary school, you kind of learn a whole new language, right? Because we have to be able to communicate with each other as professionals so that we all understand what we're talking about and we don't make mistakes and make assumptions. So we have to be very precise in the language that we use. So we learn some terminology that is universal to veterinary medicine and to radiology specifically. so that when I use that term, anybody who is trained would know what that means. And so I have to be very clear when I send my report back that there's no spelling errors, that I say what I mean. And it's very clear because the veterinarian is going to make their decisions on how to treat their patient based on what I said. So I have to make sure that I'm very correct when I do that. So I have to proofread it before it goes back to the hospital. Absolutely.
Okay. Okay.
So talk to text is good, but do learn how to spell. It makes me crazy because that's part of a medical record and it's a legal record. And how embarrassing would it be to go into court if you had to, and there's all these spelling mistakes all over your report.
Yeah.
Professional legal
Right.
document. So learn how to spell.
I have one more question.
Sure.
When did you realize how much of a passion you have for animals? About what age were you?
So it's really, I hate when people tell stories about when they were a kid, but I'm an only child. So I had lots of animals growing up. And so I had cats and dogs and I had guinea pigs. I really had a thing for guinea pigs. So we always had animals in the house. And so I'm a little on the older side. And so we used to let our cat go outside, which is really not a good thing to do if you live in the city, but we did then because we didn't know better. And our cat would come home beat up all the time. Oh my God, he fought all the time. And he would be in pieces. And so we used to take him to the vet all the time. And my mom was like, oh, I can't do this. It's just, he's killing me. It's too expensive. So we kind of learned how to do some of the treatments ourselves so that, you know, if he wasn't hurt too badly, we sort of started treating him ourselves, which isn't a great thing to do, but it was what we did back then. And I liked it. And I liked the, you know, seeing things. How is it broken? How do you fix it? What do you, I liked that. And so when I went to school, it just got better. You know, I got to learn more and more. And that's kind of how it happened. But when I was in 6th grade, and I understand there's some 6th graders that are going to be here today, we had to write an autobiography, which is kind of funny because when you're in 6th grade, you haven't done that much yet, but we all had to write an autobiography. The entire 6th grade had to write an autobiography, and it was really cool. We hung them all up in the hall and you could read other people's autobiographies.
That's a story about your life.
A story about our life. So in my autobiography, I had a chapter called I don't know, how old are you when you're in 6th grade? 12, 10?
Yeah, something like that. Yeah.
So mine was called The 12-Year-Old Vet and it's a chapter all about how we took care of my cat and what I would and like everyone, I'd go to the vet and they were like, I want to do this. Oh, okay, this is what you have to do. And so people knew when I was young, it was something I was interested in, and they just encouraged me to do it.
Well, I'm glad you told that story because, again, a lot of times young people don't realize that they are already demonstrating what they would really like to go into. Yeah. Because I love animals, Dr. Nancy, but I could not have been the one to take care of the cuts and wounds like you do because I'm too queasy. So that's not for me. So I want young people to know that if that's something you gravitate to, that's probably the career that you should be going into.
Right. And the other thing about veterinary medicine, and I'm sure you've had lots of lectures and you've heard all of this, there's so many things that veterinarians do. Veterinarians are not just clinical doctors. If you like research, you can do research. My husband doesn't see animals, he does research. Well, actually, he just bosses around people who do research, but he did research for a long time, and you don't really see animals. You're looking at slides and you're looking at, if you're queasy, but you like science and you like how it applies to animals, that's a place you can do it. If you're interested in public health, and that's a big thing right now, and making sure that everyone is safe, veterinarians are very active in public health. If you're interested in food safety, that's another area where veterinarians have a very strong role. So if you're queasy and you don't like blood and pus, then there are other areas that veterinarians do that allow them to be involved with animals and people, but don't necessarily see them in the hospital every day. It's a very cool profession because there's so many things veterinarians can do besides clinical practice. Okay. All right.
Right.
So let's talk a little bit about imaging. So this is an imaging of a dog's skull. This is the dog's head. This is his brain right here. And so this, remember I told you, you have to think in different planes and different directions. So this is like, imagine you're looking down on a dog's head and you peel back the top of his skull and you're looking straight down. That's what his brain would look like. So that's why I said you have to think about it from different directions, and you have to be able to process all that up here and know what's where by looking at it from different directions. And then this is a CT of a dog. These are the bones. So this is his head. These are his legs. That's his spine. And so they took the image and then they took really strong computer programming and they put it all together and they pulled out just the bones. And then that's where you can see the bones. And then we flip it around in different directions so that we can see what we want to see. Okay, so we're going to talk a little bit about imaging. So we've talked about what a radiologist is and what they do and how they do it, but what's radiology? What's imaging, right? And so diagnostic imaging is the use of different techniques to view inside the body to see what's wrong. And there's lots of different ways to image a patient. But when imaging became a specialty in 1961, only radiology was an option. So that's why it's called veterinary radiology. It's not called veterinary diagnostic imaging. Because it's just, in the time that I've been in there, just so many things have gotten more and more accessible to veterinary medicine. So all the techniques that are used to image people are also used in animals. And equipment's not made specific. There's a few things that are made specifically for animals, particularly horses, because there's a lot of money to be made for those companies in horses. But a lot of the equipment just has to be adapted. Human equipment has to be adapted to fit animals. So you can see right here, this is a human CT scanner. That's the scanner right there. And that's a horse, and it's anesthetized, so it's asleep. And it's on a special table. So they put the horse on the table and then they jack the table up and then they push the horse through the CT scanner. So you can see the size of the hole. So obviously the whole horse can't get into the scanner, so they can only do his head and his neck. But they do horses in CT scanners. And there are other scanners now where the horse stands and then the scanner is smaller and it can go around its legs. But there are copyright concerns and I could not show you pictures of those because I didn't have any.
Okay.
So there's different kinds of diagnostic imaging. There's some that uses radiation and there's some that does not use radiation. Oops, sorry. And so the kinds that use radiation are radiology or X-rays, then computed tomography, which is called a CT or a CAT scan. That's what we just saw the horse in. And then there's something called nuclear scintigraphy. And then there's also imaging that does not use radiation, and that's ultrasound, where they use sound waves, or magnetic resonant imaging, where they use radio waves and magnets. And most of these, all of these, except nuclear scintigraphy, the X radiation or the image generation is from outside the patient, passes through the patient to some sort of a recording device. Nuclear scintigraphy, the radiation is given inside the patient and the patient becomes radioactive and the radiation comes out of the patient and then is detected. So it's a little bit different than everything else. You don't stay radioactive.
Okay.
You
Now,
don't
Dr.
stay
Nancy,
radioactive. You don't
that's
stay
another
radioactive. It degrades over time and it's a short period of time.
Okay.
So, but you have to be very
Because
careful.
that's
You have to be very careful when you're radioactive. And with people, they tell you to, you sort of separate yourself for a little while, and then you have the scan, and then you stay separate, and then after a couple of hours, you're no longer radioactive. But yeah,
that's why I had the
but
question.
it's the only imaging modality where you actually, the person or the animal becomes radioactive. Everything else, the radiation is, or the imaging is from outside.
Oh, okay. Because I've always wondered, like when I've had an X-ray, they have on a vest, but I don't.
Correct.
And I'm like,
Correct.
okay.
Okay.
That
We're going to talk about that. So here's some of the different images that we just talked about. So these all use radiation. So this is an X-ray of a dog chest. This is a CT scan of a dog chest. So here we're looking at a dog like, imagine like slicing a piece of bread. So we're slicing the animal like a piece of bread. So we're looking at it from front to back. This is the same dog chest. Here's the heart right here. We're looking at it from the side. So we're slicing it long ways. And then here it is, here's the dog chest. And again, this is like peeling the top of the dog back and looking straight down on the dog. So again, looking at the dog from different perspectives helps me figure out what's going on, because I might not see it as well on this view, but I can see it better on this view. So again, like I said, you have to think in multiple planes. And then this is the nuclear scintigraphy dog chest, and you can see just the bones. And so what happens is again, this is not such great detail here, but this dog is radioactive, and those X-rays, the rays are coming out of the dog, and then they're being detected, and that's the image that you get.
Wow.
And then we also do ultrasound, and a lot of you, so that's ultrasound. This is ultrasound of an abdomen. You can also do the heart. And ultrasound sort of is in real time, and as sound waves go into the patient, and then they bounce back, and then they're recorded. So this is, you can again see the details not that great. So here's the liver, here's the stomach, here's the spleen of a dog. And then this is the MRI, and here's a dog brain from a different perspective. So that was the dog we looked at on the first slide where we were looking straight down. This is the same dog, and here's the same lesion, but now we're looking at it from front to back. Okay. So we're not going to talk about all the different modalities, but you can see everyone is different. And I have to know about every different kind and what different animals look like on the different modalities. And so it's a lot. It's a lot to know. So how do you know what technique to use for your patients? Well, we select the imaging study based on the question we're trying to answer, because you can see each modality has its strengths and weaknesses. Some things are a lot of detail, some things are not as much detail, some things happen in real time, some things are static. The availability of the equipment, MRI, CT, and nuclear scintigraphy are pretty much limited to veterinary schools and very large specialty practices. So you can't like necessarily go to the vet on the corner and have a CT done. It's very expensive equipment. It's hard to maintain. And you have to have specialized technicians to take care of it. So it's hard to get that sometimes. And then also the budget. You know, some people want to do everything for their patient, but they can't, their pet, but they just can't afford to. An MRI can be $2,000 or more.
Wow.
And so, you know, sometimes you want to do it, but you just can't afford to. So there's other tests that we can do that maybe aren't as, they're not as easy, they're not as obvious, but we can still figure out the diagnosis that's a little less expensive. But we usually start with radiographs to get a baseline. Almost everything always gets a radiograph. So here's images of a dog kidney using the different modalities, right? So I want to know about a dog kidney, right? So here it is on a radiograph. So here's the kidney right here. And I can see the shape of it, and I can see the size of it, but that's about all I can see. And then here's the dog kidney on a CT examination, and I can see some fat inside of it. So I can see a little bit more than I can see on the radiograph. Here it is on nuclear scintigraphy, and it just kind of looks like a blob. So I just kind of know it's there. And then here it is on ultrasound, and I can see inside, and I can see lots more detail. Excuse me. So if I was interested in a kidney disease, I might go to ultrasound because I can see it a lot better than I can on some of the other studies. So, you know, I have to think about what question am I trying to answer? And then here is a dog's head. So here are his eyes. And then here's his brain right here. And again, we're looking straight on. And this is an MRI, and you can see there's lots of detail, but you can't see the bone very well. And then here's a CT of a dog, and here's his brain right here, part of it. And here's his eyes. And then I can't see the other side so well, but you can see that the detail is not as great as what we would see in an MRI. So if I'm interested in the brain, I might do an MRI if I can afford it. But if I'm interested in the bone, like the skull, then I might want to do a CT. Okay.
Dr.
All right.
Love?
So, yes.
So can I make a point here for Bailey and the other kids that you see Dr. Love is showing you how fine-tuned her eyes are to these very specialized images. Now, as a practitioner who used to use the services of radiologists, that doesn't mean I can skip knowing everything what I need to know, and I can't skip that part and I can't miss class that day. Because when Dr. Love, whose eyes are going to do all of this looking and tells me, I see this, I see this, I see this, as a practitioner, I have to understand her vocabulary, I have to understand how it works, and I have to know what test to send to her. So I don't want you kids to think that because I have a specialist who's super great and she knows what she's doing, that I don't have to pay attention to radiology. I have to know those basics, right? So that you and Dr. Love and I can talk and understand. And when you tell me what you see and what you think I might need to do, it goes in there. So even though I'm going to let Dr. Love be the specialist, I still have to know. And I get the fun of saying, oh, okay, I see it now, or I get what she's talking about. That becomes a really important part for a practitioner.
Right. So we have to, and as a specialist, I have to understand what a practitioner does every day. So I don't know the shot schedules anymore. Like I don't know vaccines anymore, but I have to know what's the current treatment for heart failure. I have to know what the current criteria are for classifying heart disease. I have to know what medications are being used for animals that are vomiting, because that information is all in my reports. And so I have to know that so that I can understand what they've done before I see the patient, what treatments have been done. So we have to both still be aware of each other's what each other's doing. It's just that I focus more on radiology, and then the practitioner uses my expertise to treat the patient. But I still have to know what the treatments are, even though I don't do them myself anymore. So we got to know a little bit about how X-rays work. If you're going to help me read some films in a minute. So first we're going to have to talk a little bit about how X-rays work. We're going to just focus on radiographs. We're not going to talk about ultrasound or CT or any of that stuff. So radiation is electromagnetic radiation, and it is energy in the form of waves. So there are energy waves around us all the time. You can't see them, you can't taste them, you can't smell them. But right now, you guys, I can see you too. There are waves, energy waves just floating around you in that room right now, right around me right now. The smaller the wave, the higher the energy, and the more the energy interacts with your body. Too much exposure to the high energy X-ray, the high energy waves like radiation can be dangerous. And so that's why the technicians wear protective devices when they take you in for the X-ray, because they're around them all day long. And so they can't get exposed over and over and over again. But for you to have a test done, that's okay. But for them to do it 50 times, that's not okay. So that's why they wear protective equipment when they're in the room. And so super high energy radiation is sometimes used to treat cancer. That's what the radiation oncologists do. So the veterinary radiation oncologists, they work with radiation to treat cancer patients. I don't do that. That's outside of my expertise. But there are people who that's just what they do all day, and they decide what kind of cancer, how much radiation, where to give it, how many times to try to kill cancer. So radiographs, CT, and nuclear scintigraphy all use radiation. And if you have any of those procedures done, you'll see that the people that are helping you, the technicians, will always have on protective gear because they can't get exposed over and over again because they do it all day. So here's like a picture of the wavelengths, right? So right now in your room, there's wavelengths floating around for TV and radio. There's wavelengths floating around for your phone, for your cell phone, and for microwaves. And then if you have a radiator, there's waves from that. There's light waves so that you can see. So there's visible light waves. Ultraviolet waves are the waves that come out of a tanning bed or out of the sun. And then as the waves get closer and closer together, that's X-rays, because those waves interact with your body, and that's enough to make an image. And then when they're super high energy, they don't make images, they start to kill cells. is in radiography and veterinary medicine because it's easy to do. Most practices have it. It's not that expensive. And so what happens is the animal's placed between an X-ray tube and a plate that receives the X-rays. And then the interaction of the X-rays and the tissues of the animal results in an image on that plate. And then what happens is the X-rays are absorbed differently in the tissues. And that's what makes you see the different shades of gray. So metal absorbs a lot of X-rays and it's super white. And then bone absorbs a lot of X-rays, it's white. Soft tissue absorbs a little less, it's light gray. Fat less, that's dark gray. And then gas, like your lungs, air in your lungs, it goes right through and that's black. Okay, so again, that's going to be important. We're going to come back to that, right? So here's the dog's chest and an abdomen. We're looking at it from the side. So the dog's head is up here, his tail is back here. This is the top of the dog. Here's the bottom of the dog. So we have a positioning marker on here so we know which side of the dog is down. It's metal. You see it's the whitest thing on the screen. So it's absorbing a ton of X-rays. Bone is white. It's not as white as the metal, but it's also absorbing a lot of X-rays. Then here's the kidney again. It's light gray. It's gray. It's absorbing less than the bone and the metal, but more than the fat, which is dark gray. And then gas in the stomach or gas in the lungs is black because the X-rays are almost entirely passing through. Okay. All right. So that's what lets us see the difference between on the film, right? So when we look at a patient, we take two views and usually we lay the dog on its side. And then that's what we call a lateral view, or we lay the dog on its back. And then that's what we call a ventral dorsal view. So it's going through the bottom, through the top. So your new medical terms for the day. The bottom of the dog is called the ventral aspect of the dog, and the top of the dog is called the dorsal aspect of the dog. So we say ventral dorsal because the X-ray beam comes out of this machine here, and it goes through the ventral part of the dog, and then out of the dorsal aspect of the dog to the plate. So when I'm talking to a practitioner like Felix, I'm like, hey, Felix, I took a VD view. He knows instantly that how the dog was laying on the table when we took the film. So that's what I mean about you learn new vocabulary that we all can use to talk about together and we understand what we're talking about. We take two views because it helps me be able to put 3 dimensions to 2-dimensional image. So I can see it in different planes and I can think about it in multiple ways. So now we're almost done. We're going to look at some radiographs. And I'm going to need your help to help me diagnose these films. Okay, so is everybody up for it? You two up for it? So who do I have? Who do I have with me?
We got Bailey.
I have Bailey and who
We're gonna
else?
let Miss Bailey go after first.
I can hear.
Well, there's quite a few people, but Bailey is our young student.
Oh, there's quite a few. I can only see Bailey and her friend.
That's Bailey's mama.
Oh, is that her mom? I can't even see that well. Bailey's mama.
looking so young, right?
Bailey's mama.
You look so young.
All right, so we're gonna start. Well, Bailey's mom, you can help too. So here we are. Okay, so this is our first case, you guys. So this is a dog. It's a lateral radiograph, so the dog is laying on his side, right? So the X-ray beam is going through. The dog's laying on its right side, so it's going through its left side, then through the dog, then to the right side, and into the plate, right? So here's our normal dog. So the head of the dog is this way, the tail of the dog is this way, okay? So we have our liver right here. Then behind the liver, we have the stomach. Then behind the stomach, we have the kidney. And then at the bottom, we have the spleen. And then we have these tubes that have gas and our soft tissue, and those are our intestines. And then we have our urinary bladder back here, okay? Oops. Gave y'all the answer. So I hope you, so this is our abnormal dog, right? So hopefully you didn't read the answer. So what organ did we think was abnormal? If we look at this and then we look at this, what do we think looks not right? Okay, Bailey?
It kind of looks like the stomach.
Okay. So what do you see that looks in the stomach that looks, tell me, describe what you see that doesn't look right.
Like on the dog that's normal, you can see kind of some light streaks, maybe bones or something going around it. And on this one, you can see them, but there's other white stuff behind it.
Just like white stuff and what, so what's the shape of the white stuff?
Like strings.
Like strings. Okay, good. Now, do you think the
Yeah.
stomach is the same size or bigger than it was on the normal dog?
It looks a little bit bigger.
Looks bigger, right? So it's bigger and it has all these white things in it that look like string. Okay. So that's what, so that's what we think is wrong. And so very good. That's what's not normal. So what's wrong? The stomach's, the stomach's not normal. And what happened was this dog ate a ton of hair ties, like a ton of hair ties. Dogs and cats, for some reason, really, really like hair ties. And it's super, super dangerous for them to eat hair ties because it'll make them very, very sick. And it can kill them, actually.
Like the stretchy thing?
Yes, like the stretchy things that you put to pull your hair back. Dogs and cats
Yeah.
absolutely love them. I don't know why. We see it all the time. So what would we do? Well, we would do surgery to take them all out. So do not leave your your hair ties lying around. It can become very expensive to your parents and make your animal very, very, very sick. But that's what this is. So, all right, good job, Bailey. You have just diagnosed your first radiograph. Good job.
Woohoo!
Woohoo.
Yay!
All right, so here's our second dog. Now, again, remember, so this is a ventral dorsal view, right? So the dog's lying on its back. The x-ray is going through the bottom of the dog, through the top of the dog to the x-ray plate. So we're looking down on the dog. So here's the heart right here in the normal dog. This black area is the lung. These white tubes are ribs, okay? So this is our normal dog. This is our abnormal dog. So who wants to try to tell me what looks abnormal?
Bailey.
The heart is bigger and the lungs look clouded, like they have
Very, very good. That's absolutely excellent. You got a good eye, Bailey.
This is so cool.
You got a
This
good
is
eye
so
because
cool.
that's exactly what's wrong. So the heart's too big and the lungs are not normal. So I know you're not a veterinarian yet, Bailey, but what do you think?
She's on her way.
What might be wrong? What do you think could be wrong with this dog? Just take a guess. It's okay if you don't know. It's just give it a shot.
Maybe like the blood going to the heart, it's like getting clogged up in some spaces.
Okay. So do you think the heart's working normal or abnormal?
Yeah.
Abnormal.
Right. So the heart's not working right. And because the heart's not working right, it's too big. And when you actually are on the right track. And so things kind of get clogged up. And when the heart doesn't work right, then the lungs get affected. And so this dog is in what we call heart failure. So his heart's not working right. And so his heart's too big. And that's one way we know the heart's the problem. And then the lungs are not right. And that's very common that we see that with hearts that aren't working right. So what do you think we might want to do next? Anybody?
Heart surgery?
That might be a little ambitious.
Or I don't know, but you might have to put the dog down because it looks.
Oh, no, there's things we can do before that. He's sick. So if you have a sick
Give him
heart,
medicine?
give him some medicine. Right.
Wendy says change the diet.
Change the diet. That's actually a really good idea. So this is a heart that's too big. The heart's too big, and the lungs are abnormal. And so the heart is, I can't see anymore. So I'm sorry, you guys, I can't see what I wrote. But what we would do in this patient is, so I would tell Dr. Felix, I was like, hey, he would say, oh, my dog is not feeling well. It's coughing. And it doesn't want to do anything. It's just laying around all the time. So I would look at this and I'd go, well, his heart's really, really big and his lungs don't look normal. This dog's heart's not working anymore. I think you should treat it with medicine to make it feel better. And so he would give him heart medicine. And then I would say, well, when you're done giving him the heart medicine, let's take some more x-rays to see if your medicine worked. And if his heart and his lungs look more normal than abnormal. So that would be how we would work together for this patient. So he would tell me, this is what's wrong with my dog. And I would say, well, this is why what's wrong with your dog. So you say, my dog's not acting right. He has a heart murmur. He's really quiet. He doesn't want to eat. And I'd look at this and I'd say, because his heart's not working anymore and it's really bad. And I'd say, you treat him for heart failure. And he goes, okay, I'll treat him for heart failure. And I'll like, send me back the films after you've treated him and let's see if your treatment worked. And then you keep sending me films every month, just so we can keep an eye on that heart to make sure it's not getting any bigger. So that's how we would work together to treat this patient. Good job.
Wendy says, would humans have statins?
Humans would have statins. We do not give statins to dogs right now. We treat them with a medication. They get other heart medications. And then we treat them with a diuretic that people use. It's called Lasix or furosemide, and people use it to lose weight. But they also use it to make the fluid in the lungs go away. So we don't use statins so much in dogs, but we do use all the other heart medications in the dogs. So here we've got a horse, because remember, I don't just do dogs and cats. I have to do horses, and I have to do cows, and I have to do lizards, and I have to do fish, and I have to do turtles. So here we have a horse foot. And so this is, so can you guys see my hand?
Yes.
So the way horses, all the anatomy is different, right? So we have 5 toes, and horses used to have 5 toes a long time ago, but now they only have 3, right? So they have 2 short ones on the side, and then they have 1 long one in the middle, and that's this one. So horses stand on like this. And so that's what we're looking at right here. So this, if you look at your finger, the part that's closest to your hand would be this, and then the middle part would be this, and then the very tip would be this on your hand, but that's the horse, right? So this is our horse, and this is our normal bone, or sorry, this is our normal foot, but this is our abnormal foot. So I told you, here's P1, here's P2, here's P3, and here's the navicular bone. So when you look at the abnormal foot, which bone do you think is abnormal? P1, P2, P3, or the navicular bone? Hey, Wendy, what do you think? This one's a little harder, isn't it?
P3 maybe?
P3, all right. Anything else do we see?
The bones are wider.
The bones are wider, okay. So when somebody said P3, what's wrong with P3? What makes it
It
different?
looks like there's a little bit of a spacing down at the bottom right of the front there. Is that normal?
Right here?
Right there. Yeah,
Okay, so you think there's a piece missing?
it looks like it.
Okay, all right.
Wendy?
Okay, so this is also the hoof wall right here. Does the hoof wall here look the same as the hoof wall here?
No, there's a dark spot or something.
There's a dark spot. All right. All right.
Wendy?
Yeah, I don't know what I'm looking at, but P1 doesn't look the same to me.
P1 doesn't look the same. How does it look different? How does it look different, Wendy? See, I have to tell people how it looks different. That's what
Exactly.
this is
I
our
understand what you're saying.
radiology part.
It's like
Not easy, is it?
Find Wally.
Okay, so I guess
it looks shorter to me.
it looks shorter to you.
abnormal.
Okay, that's
Yeah.
very good. So that's actually a manifestation of how I cut it and pasted it. But that's a good
Okay,
pickup.
fine.
That's a good pickup on your part because you're absolutely right. But that's just how I cut and pasted it, and that's how it's positioned a little bit differently. But good pickup.
I'll
All
take
right.
that.
So our bone that's abnormal is P3. Very good. There's a piece that's missing. And then there's a dark spot in the hoof wall. And so that dark spot in the hoof wall tells me that this horse has an abscess or an infection in his foot. And that infection has been so bad that it's starting to eat away a piece of the bone. So then what we do is what we would do next is I would tell the doctor how you need to go ahead and treat that abscess. And what they would do is they cut it out and then they put antibiotics in it and give the horse antibiotics to get better. Okay, this is our last case. And this is a cat. And again, this is a cat laying on its side. And we're looking, down on its side. And so here's the head's this way, the tail's this way. Here's our heart. The black is the lungs. The black tube is the trachea or the windpipe. The white tubes are the ribs. The white back here is the spine. So this is our normal cat. This is our abnormal cat. What do we think is abnormal? What organ do we think is abnormal?
Bailey.
The lungs.
Very good. And what do we think isn't right?
It has those circles in it.
It has circles in it, right? All right. And so those are not supposed to be there, right? Anybody have a guess on what those might be?
Fluid?
Blood clots.
Blood clots, that's a good thought. What if I told you this cat was 20 years old? That's really old.
Hairballs.
I'm sorry, what?
Hairballs.
Hairballs, okay, that's a thought. That's, yes. That's actually can happen in the lungs, and there's some gas in some of these balls. But this cat's really, really old. What's a bad disease that happens to really old people or animals?
Arthritis? Would that show up in the lungs?
No. You are a very optimistic group. Uh-oh, Robert. My screen I just lost my screen.
Emphysema.
Hold on, you guys. I just lost my screen.
Okay.
Oh,
We can still see it.
well, we can still see it. Oh,
Yeah, but I just lost everything.
No, 1 second.
I'm using my husband's computer. I'm sorry, guys.
It's okay.
And we'll say hello, Dr. Robert.
Hello, how are you?
Well, thank you.
This has been super.
There we go.
it really has. It's so
Okay, so
interesting.
as I said, you guys are an optimistic bunch. So
Someone
this
said
cat actually
emphysema.
has masses
Yeah.
in his chest that are cancer.
Oh, she
And
said
so
cancer. Uh-oh.
that's why I say super old. Yeah. So what we would do is we would take films of his abdomen to see if we can find out where the cancer might be coming from, because this is usually spread of cancer, actually not the most common site. Okay. So again, this is what I do all day. And now you guys have done it too. And I'm really, oh, we got one more. I thought I was done. Sorry, we have one more.
One more.
All
Oh,
right.
this is cool.
This really is the last one, I promise.
Okay.
So this is a dog leg. We're looking at it from the side. The dog's facing to the left. So this is a back leg, right? So this is the femur. So this is the first bone of your leg. Then this is the patella or your kneecap, right? And then this is the tibia, and then this is the joint space. And so this is the abnormal bone. So, or the abnormal leg. So what's abnormal on this film?
Haley.
It kind of looks like the knee or the patella is
Okay.
worn out and
Okay.
it's rubbing against the other bones, so the other bones look messed up too.
Okay, well, okay, messed up. I like that, but can you, like, how are they messed up?
They don't look like they're formed the right way. They look different.
They
from
look
the-
different. Okay, so do they look like maybe, do you know what Pac-Man is? Or are you too young to know what Pac-Man is?
Pac-Man is old, Nancy.
I know. That's why I asked, because I know it's really old.
I just
Okay, so but it kind of looks like somebody's taking a bite out of those bones, doesn't it?
Yeah.
Like maybe there's
Yeah, it does.
pieces, like maybe somebody, like things have been like sort of pulled out of it. So there's like holes in those bones, right? Is it just the patella? Is it just the kneecap, or are the other bones normal or abnormal?
all the other bones.
All the other bones are abnormal too, right? And so then if we look at, so there's like big holes,
Mhm.
like a big chunk. And then there's some holes in this tibia. And if we look at the joint space, right, it looks kind of dark gray on the normal bone, or sorry, on the normal leg, right? But if we look at the abnormal leg, does it look dark gray or like a lighter gray?
Lighter gray.
It looks like a lighter gray. So that tells me there's something in there in this abnormal leg that's not here. So we said that dark gray is fat, and we said that lighter gray is soft tissue. So there's some kind of soft tissue in that knee. So this is cancer. And so what would we do next? We would try to find out what kind of cancer it is. And so we would take a piece of this fluid, or we would take a piece of this bone, and then we would have another specialist like Monique, a pathologist, look at it and tell us what kind of cancer it is. And I'd also tell the veterinarian to take radiographs of the chest, because like we saw in our last case, cancer can spread to the chest. And so we would want to see if the cancer has spread in this dog. So again, I would look at this, I'd say, oh, he's abnormal. This is abnormal. This is how it's abnormal. This is why it's abnormal. This is the tests that you have to do to figure out if what I think it is correct, so you can start treating it. Okay. So you guys did really, really good. I am very impressed. You are now junior radiologists. It was a nice job. And I'm very impressed with your skills today. Bailey, you know, bang up job. I think you could be a radiologist if you wanted to.
All right.
It's a lot of fun.
All right.
So if you want to be a radiologist, you got to study hard. You got to get good grades. Got to take science courses. I would encourage you to spend time with a radiologist to see what it is that we do, to see if it's something that you really want to do. Because I didn't do it until I was in veterinary school. I didn't even know there was such a thing as a radiologist until I was in veterinary school. And so I was kind of late to the game, but now you know. And so you can find out more about it. And there's all kinds of stuff now on YouTube, and you Google this stuff, and there's videos you can watch about how they make radiographs and what they look like. And if you are interested in this, there's a ton of stuff out there that you can start to see and see if it's something that you're good at and you like, and you might want to learn more about it. Volunteer with jobs that have animals, like a veterinary hospital or a shelter, or work at a horse facility like a barn. And if you're interested in imaging, you could work in a human hospital as well. You know, it doesn't just have to be veterinary hospital, but get exposure to medical field and see what the hours are like and what the demands are. And if it's something that you think you might want to do, because it's something it is a career, and it's a profession, and it does take up a lot of your life. And so you want to be happy with what you do. And I think this is a super cool job. I wouldn't want to be any other kind of veterinarian but a radiologist, and I'm glad I did it. So this is the end. I really appreciate you guys coming today. This is what I do when I'm not being a radiologist. I ride my horse, Mimbro. He is a Pura Raza Española, or a PRE. He's 18 years old. He's very highly trained, and he's a super fun horse to ride. I compete him all over the East Coast. This is my brand new horse. His name is Carante. He came from Spain. I was supposed to go to Spain and look at him last year, right before the pandemic. 3 days before I was supposed to go to Spain, I canceled the trip because I didn't want to get COVID. And I looked at lots of videos, and I talked to the breeder a lot. And I said, okay, I'll buy him. And they shipped him over to me, and I'd never seen him before until he showed up at my barn. And he's a wonderful, wonderful horse. He's only 5 years old. He just turned 5, so he's a baby. He's just learning how to be like this. And he's also a Pura Raza Española, so he came from Spain. And then these are my 2 little puddins. This is Pippa. She is a wire fox terrier. And this is Simon. I will have had him a year. He's a Lakeland terrier. And these are my dogs that I play with when I'm not looking at films. So I really appreciate you guys coming today. I had a good time talking to you, Bailey. I really appreciate you participating as much as you did. Sometimes it's kind of hard to put yourself out there, and you did a really good job, and I really appreciate it, and I'm impressed with what you did today. So thank you.
All right, this is too cool. I am so excited. Let me ask you one question, Nancy, before I allow other people to ask any last things before we go. Sure. When we kicked off YVI in June, I talked about how it is important for people to focus on science. People who are interested in veterinary medicine to focus on science. But I also said that it's important to nurture whatever artistic inclinations you may have. And I specifically talked about radiology as a reason to hone your visual arts skills. So I want to ask if you have any, do you do anything like that? Do you doodle or color or?
No.
No?
I am now of the, I've been reading things lately that said you don't have to be good at art to do art. And I am definitely very strongly in that category. I am not particularly artistic, but I have an insane eye for detail. I can walk into a space and pretty much see everything with just a quick glance. Like if there's dust in the corner, I can see it like that. And so, whereas I'm not particularly artistic, I just can see everything really easily, really quickly. Okay. And so that's why radiology works for me. But, you know, as I said, I didn't even know what a radiologist was when I went to vet school. And you can see I have 2 horses. I was going to be a horse doctor. I wanted to be a horse doctor. And when I got to vet school, I was like, this isn't what I want to do. It's what I always thought I wanted to do. I got there, I saw all the different opportunities that veterinarians had. And I said, nope, I want to do this. And so, you know, you may think you know what you want to do, but the more you learn and the more you have the opportunity to be around different types of veterinary medicine, then you may change your mind. Because I was going to be a big time equine surgeon. And then I was like, no, I don't really want to do that all day. So it's okay to change your mind.
It absolutely is. I thought I was going to be a small animal practitioner until I got to vet school, and I turned to pathology first semester, second year.
Yeah.
Never looked back.
Yep. And I thought I was going to be an artist. Here's my first self-portrait. You'll see how good it is. Looks just like me, huh? So see, Bailey, you can do art too.
That's really good. That's really good.
Does anybody have any questions for Dr. Nancy?
Well, I just want to kind of talk about Bailey just for a moment. Bailey, I'm not sure if you're still volunteering, but Dr. Nancy Bailey had been volunteering at an animal shelter, a dog shelter,
Mhm.
which we are so proud of her
Yep.
in doing that. So Bailey, in what was presented today, were you exposed to seeing maybe some x-rays that the vets were the shelter was looking at, or did this open your eyes up to anything else based off of what you've been doing?
Well, one time I got to see the vet give shots to a cat, but that was really it.
You do a lot of
Okay.
cleaning, don't you? You do a lot of cleaning, don't you, Bailey?
Mhm.
We all did that. Just so you know, we all cleaned cages. All of us cleaned cages at a lot of cages. So
Yep.
kind of where we all start. So it's okay. It gets better.
Yeah, you have to earn your scoop the poop t-shirt.
Yep.
Oh, yeah. Yeah.
The other thing that you can do, Bailey, when you're cleaning cages and doing things is look at the animals that if they're in there. If something doesn't look right to you, you tell somebody. If a dog that you see every day is quieter, tell them. If the dog is coughing, tell someone. And that's how you start doing more and learning more about the veterinary, the medicine part of what you do than just cleaning the cage. Start paying attention to the animals that are around you and notice any differences that you see between the times that you see them.
This has been so interesting. I thank you so much for coming
Good.
on. Are there any other questions?
All right.
Well, if not, Dr. Love, I have loved your presentation.
Well, thank you. Thank you. I really appreciate everybody coming today.
We look forward to you coming on. I would love, and I'm sure everyone else, for you to possibly present to us and we see your horses live. We've had a lady horseshoer on before. We've had Veronica presenting in front of her goats. And if you would like to introduce us to your horses, I mean, I'm a real horse fan.
Okay.
We would really love that.
You don't have to ask me twice. I'd love to talk about my horses. So we actually have 3 horses. You know, you started it. We actually have 3 horses. We have 2 competition horses, which are mine. And then Robert, my husband, has a horse, but his horse is retired because he used to compete as well. And so we used to go to the horse shows together. We didn't compete against each other, but we did compete at the same shows. But his horse is retired now, and his horse just hangs out and eats grass and hangs with his friends. But my horses actually have to work. But I would love to show you around our farm and what it's like at a dressage barn on a busy day, and what working students do, and how you can get some experience at a horse farm, and how that might help you with veterinary medicine going forward. Because you have to know more about than just dogs and cats. And unfortunately, our kids in the city often don't get access to the larger animals.
Okay,
So, sure.
That would be excellent. Are there any other questions? Well, if not, we've taken up so much of all of you guys Saturday morning. We thank all of you for being on, and we thank those of you that will be listening to the recording for following us and being a part of the YVI community. Again, Dr. Nancy Love, you have made the most lovely, I can't help but just keep using your name, presentation, educational, exciting, interactive, all of that good stuff. And I can't wait to send out the recording for others to be exposed to you and to want to know more. We look forward to you presenting to us with your beautiful horses. We love 4-legged babies and being introduced to them. So again, thank you for being on. Thank you all of you for participating with us today. Thank you to my co-host, Dr. Monique Wells, coming to us from Paris, France. Monique, we know it's late there, and we love you and are so glad that you're involved with us with YVI. I thank all of you, and have a great Saturday.
Thank you all. I just want to say one more thing, though. Felix has sent me a note just to say that the Black veterinarian, the Black veterinary radiologist, as you were talking about at the beginning of your presentation, Nancy, it's important for us to know that there are Black people and brown people who are doing this work.
Right.
And so don't be afraid because you might be the only person in your class interested, or you know, the only person once you get out of school and into the workforce, you're the only one. It's okay. There are others. We're rare, but we are not alone.
That's right.
Mhm.
Yep.
That's excellent. Excellent. Well, thank you so much. And we would love to be introduced to her and she present to our YVI community.
Yes. Love to
Alrighty.
everyone. Thank you.
Bye.
Thank you. Have a good one.
Bye.
Bye.